So I'm going to show you our extension mobility progression when you have an extension bias with low back pain, or if you're working to restore extension. This is great for patients that are looking to decrease their pain related to lumbar stenosis. That said, if you go too much too hard, you could flare up. For those of you that like flexing hurts and extension feels good, this is where we start. So first and foremost, we go ahead and lay on our back and we practice tilting that pelvis by pushing belt buckle down towards nose and kind of arching that back. And this should feel good and helpful, okay? Then the other thing you can do is you can just spend some tummy time. So with tummy time, you just lay down, rest your head, and you just hang out here. And then you could do some belt buckle down towards toes also to kind of arch a little bit more. If tummy time feels good, but it's a little too much, you can do a pillow under your stomach just to start with a little less extension. And you can hang out here for 30 seconds, couple minutes, whatever feels good. Then we will actually want to start extending. We usually start that in standing. So you would try to find a wall and lean into the wall. And then basically you let belt buckle point down towards toes and kind of just let your hips sag towards the wall. And so we start with this supported position. And then we work into some standing back bends on our own. And it kind of depends on the presentation. Sometimes squeezing your glute muscles a little bit as you do this helps. Sometimes it feels better not to. Okay? So you can kind of work that. And on this, we're just letting the low back extend. Long term, we would want to think about being tall and kind of getting this nice global extension through our thoracic spine and our low back and glutes and the hips, and get our hips forward past our toes, and even arms up overhead. So that would kind of be an eventual standing progression. But initially, just wall and then off the wall, okay? And then sometimes the very end range hurts you, so stay just short of that, just to it but not through it. Then our progression is going to be onto our stomach. And first, you're just going to press up onto your elbows. And it depends on the person, in my experience, whether just hanging out here for 30 seconds or so, to a minute feels good, or if it feels better to kind of repetition 10 to 20 times. So with that, the dosage is, it depends. Usually we say 3 times a day, but sometimes like every hour feels best with this. And then basically with this, you just pick and progress to what feels best. So you kind of work along this. Eventually one might be a little too aggressive. Same thing with this, you can squeeze the glutes a little bit. Then you're gonna go hands under shoulders and you're gonna press up. And you might only be able to get to here initially with a hold or arch, but the goal would be to be able to get all the way straight. And then with this, yes, I'm moving through my low back. I do want to think about being tall through my chest, kind of getting my breastbone, my sternum forward a little bit. And then you can just squeeze your glutes a little bit to help control and get the hips. Ideally, I'm trying to keep my 2 front hip bones here, they're called your ASIS, as close to the floor as possible to definitely work to get my hip extension as well. And so same thing, you could hold this for 30 seconds or a minute, or you could kind of repetition it. Okay, then if there's one side that hurts you more with the flexion stuff, like let's say it's my left side, I can walk my hands to my left and press up to close that side down further. And I would just do this modification if it feels better to do this than it does feel to do the regular press up. So that is our extension progression. And then you would just follow the playlist and follow along with our other extension biased exercises. And then as you own those, then you would switch and make sure to own the flexion bias. All along, you can work on our neutral spine and core control exercises as well. So the goal with all that is that the extension stuff helps you have less back pain and less leg pain, and feel better and like you can do more. So hopefully that is helpful, and go ahead and progress in the rest of the extension-based mobility and strength exercises.